Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio at 888-630-9625, 888-630 WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've tried, you've applied, you've done everything you can to put out the fire. Well, guess what? We may have different options without drugs, without surgery. We have a topic for you, and I have a guest, and a topic that unfortunately affects so many people is the cost of billions of dollars, both to you direct and indirectly because of your lack of production. But here's the deal. Headaches and migraines are something that many of us ultimately will experience and drive us into doctors' offices more so than anything else. It's one of the number one reasons why we don't do the things we want to do in our life, that we say, just don't bother me, close the lights and close the shades, and we'll think about it tomorrow, as they say. Well, this Wednesday the 13th, in our office at the Roselle Center for Healing, we have our special in-house continuing education program on headaches and migraines. And your host, your presenter, will be Dr. Harlan Browning, who is my guest today, this afternoon, at the special time that we do all of these things. Hello, Dr. Harlan.
Good morning, Tom. How are you?
And we're going to do a very interesting topic. I'm great. I'm finally got my sea legs back. I think I'm back in this country now, and my energy's better. And last week I was a little kind of, flat and
jet lagged.
Yes, but it's coming back. I'm my same old obnoxious self now.
I think so. Yeah.
Be careful. You have to work with me more. But anyway, let's talk about headaches a little bit. And it truly is one of those things that, when people get a headache, sometimes they want to hear my old expression, when you hear hoofbeats, look for horses, not zebras. And unfortunately, many people and many doctors look for the zebras first. And the truth of it is that 90% or over 90%, 95% of all headaches have nothing to do with tumors or vascular problems or space occupying lesions or anything like that. So my question to you is, to start the conversation simply is, when you have a headache, when you have a pain in your head, how do we distinguish them? How do we know we're in trouble? And really, what kind of headaches are headaches?
When I look at headache patients, I really think about 9 things that most of the time cause the problem: nerve compression, vascular disorders, toxicity in the body, inflammation, hormonal problems, jaw or TMJ issues, muscle tension, and rebound or medication-induced headaches. So a lot of times it's a combination of several of those things, but the problem is you got to figure out which ones are instigating it and certainly kind of come up with a plan to fix it.
The interesting thing, particularly right now, today as we walk into the studio to do the program, we were talking about how hot it was, and it was 88 degrees outside, and it's going to get hotter before the day's out. In this time of the year particularly, the number one cause of headache is dehydration. And it's that dull, just ugly feeling that kind of is all over your head and you don't feel good. And then you add that to not having had anything to eat or not wanting to eat, and suddenly you got a headache. But that's easily remedied. All you got to do is get a glass of water, put a little sea salt in it, drink that down, have a couple of them that way, and keep hydrating the rest of the day, and you'll find that goes away pretty rapidly. But that's not what we're talking about. What's the most common type of headache that people suffer from that becomes chronic, that stays there, day in and day out sometimes, and they're taking all kinds of medications, and life is becoming worse?
I think it's probably muscle tension headaches, and the ones that develop in the back of the head, and they often will move forward and kind of envelop the whole skull, just because, what we see here in Northern Virginia, in the D.C. area, there's a lot of people that work for long periods of time, and they're sitting in front of a computer, they're bent over, they're looking down, and over time, the muscles in the back of the head just get so much tension in them and ultimately start to cause pain. So I would definitely say muscle tension would probably be the number one.
Now, that muscle tension headache can be broken down more specifically in our field of manual therapy, chiropractic, even in osteopathy and so forth. When a patient goes in, we look at it from a biomechanical point of view, and that biomechanics has to do with misalignment, and we talk about bones being out of place and causing stretch irritation or nerve root compression on the nerves. Subsequently, we have pain and can cause a headache. The terminology that we use in chiropractic is spinal subluxation, and osteopaths call it a spinal lesion. But the end product is the same thing. Bones can cause a torquing and a torsion and an irritation to the neurological area, particularly the neck and the brainstem and so forth. But muscles move bone.
Yeah,
and that's where we get into that.
And certainly, there's a lot of unique muscles in the back of the head. There's something called the suboccipital triangle. It's a series of really tiny muscles that attach from the skull to the first two cervical vertebrae. And when they start to traction, then they're going to compress nerves that are right underneath of them, and they're also going to cause a torquing or a turning of the vertebrae. The interesting thing is, in the late 90s, University of Maryland found that there's a connection between one of those muscles where it physically attaches to the membrane that surrounds your brain and your spinal cord, called the dura mater. So when that muscle becomes loaded, it directly pulls on the brain. So the fact that those muscles get hypertonic or get real tight can cause a cascade of events, anywhere from just localized irritation to compression in the nerves to the head and the face, and then we often will see the other things that are involved with it, like the people will get faint, or they'll feel dizzy, or they'll have ringing in their ears, or visual problems too.
Now, when you talk about that whole mechanism of the dura mater and so forth, and dura mater, by the way, is it means hard matter. It's this plastic wrap, if you will, that attaches itself to the skull, comes around, and then comes down and surrounds the spinal cord, and in between that you have the spinal fluid. It attaches at the second vertebrae of your neck, and when those vertebrae move, and that's what we're talking about, it can cause a torsion, a tenting effect, if you will, on this hard substance, and then the ramifications from that point on. Now, depending on where the irritation is structurally, you talked a little bit about TMJ, but the rest of the cranial bones move. When when somebody opens and closes their mouth, if their vertical dimension, it means the dimension of attachment of the jaw to the skull based on the height of the teeth. If that's not working the way it's supposed to, and so many patients have problems with their jaw equilibrium, if you will, because of bad dentistry. And dentist cuts the filling short, or he doesn't approximate it properly, it doesn't line up the way it's supposed to. That can send a huge neurological aberration to the whole body, causing not only headaches but other types of problems as well.
Yes, certainly. One of the things that's pretty common is people have their teeth ground down to make their bite more approximate or be closer together. But the problem with that is, as you lose that dimension that you're speaking about, that's really the distance between your top lip and your bottom lip, then the muscles of mastication, the muscles that we chew with, have a greater resting tension. Well, they're not designed to do that. So as they get tighter and tighter, there's a greater likelihood that they're going to tell you that there's an issue there, and that's the form of the headache or the TMJ popping or clicking.
So question, and something that I tell patients all the time, good or bad, people who chew gum?
That's a great question. I think it can go either way. Certainly if you have TMJ problems, it could be an issue. Now, having said that, the interesting thing that I have seen before is some people chew gum to actually help stabilize their TMJ. So they'll chew on one side. They won't think about why they're doing it, but their nervous system tells them to do it because it stabilizes the position of the jaw. So I think that's a double-edged sword. Certainly I tell people who have TMJ problems or have headache problems to be careful with the gum, but I'm kind of reserved on where I stand on that. But that's a great question.
There's a couple triggering mechanisms, as you know, that when it comes to chewing gum and moving the jaw all the time, or chewing on things, anything, whether it's a pencil or putting something in their mouth. A lot of people, for whatever reason, like to chew on paper clips, and they have that in their mouth. But it's neurologically, their body may be trying to right themselves, but also just maybe a habit that they're getting into. The thing that I've noticed, particularly with patients who have allergy reactions and also other types of gastric gallbladder reflex patterns, is that when you chew something and there's nothing in your stomach to digest because you're triggering saliva, and saliva triggers the stomach to produce acid, and acid triggers the gallbladder and the liver to work the way it's supposed to, as well as the pancreas. You've got this reflex pattern that can affect acupuncture systems, gallbladder pathways that affect the head.
So, yes, certainly, and from that standpoint, most definitely. And there's a lot of people who let's just say don't have very good digestion, that don't make it better by having habits, certainly like chewing gum or chronic use of mints. Semi-sweet or artificially sweetened mints will do it to them, which is a travesty in itself.
Well, people don't realize that the neurologically, when you put something in your mouth that's sweet, the body doesn't distinguish between an artificial sweetener and something that's sweet. It reacts physiologically the same. Talking about headaches, your host this Wednesday evening, Dr. Harlan Browning, my guest in studio today, Wednesday the 13th, at the Roselle Center for Healing. Dr. Harlan Browning will be presenting a topic of headaches and migraines. If you've been suffering from either one of these things for a lot of years, you're on medications to try to get rid of them. No matter what you try, they still show up. This is your opportunity to find out how to get off things as simple as Advil and Aleve, but more importantly, things like Motrin and naproxen and Prodrin and Percogesic and so forth. And the list goes on and on and on and on. You don't have to suffer with headaches. There is a way of fixing these things. Dr. Harlan, and you know the story. Years ago, before I decided to do what I'm doing, I was accepted to medical school and on my way, but I decided to spend 2 semesters in chiropractic college and to find out what all the hullabaloo was about, because the undergraduate education or the graduate education, the first 2 semesters are the same with anatomies and physiology and pathology and all those things. You and I went to the same school, so we know. But the woman I was going to marry, Sue, had been suffering from severe migraines since she was 6 years old, and they were getting progressively worse, to the point that they told her that if when the medication didn't work, which would knock her out for a couple of days a week, or the migraine would, that they would ultimately go in and do a cervical fusion. They were going to fuse the bones of her neck, thinking that they would stop the irritation to the cord. Obviously, that wasn't something either one of us would, willingly accept. So I said, let's see what happens. So we started in Elgin, Illinois, at the Gonstead Clinic, Kellenberger Clinic, and where they did very, very specific work. And the short end, after all those years, within less than 30 days, her headaches were gone, and they've never returned to this day. And I've been in practice many, many moons. So we see that kind of application.
Yeah, we certainly see it. And going back to touch on the analgesics and the aspirins and the Motrins, I think that in itself is the reason why headaches are not looked at more significantly, just because it's very simple to take a pill, make the headache go away, for a couple hours or a couple days, just for it to come back. Unfortunately, we can go to the store and get some, pretty powerful things off the shelf to help with pain, which, in many cases makes us just ignore the problem, which obviously is not a good thing.
Well, let's talk about, we have about a minute before we have to take a break, but let's distinguish so we can kind of set this, for our ongoing topic in the next half of the program. What's the difference, and what is, if you will, a migraine versus a headache? How do people really know the difference?
Well, symptomatically, that's the way we really determine what a migraine is versus a headache. And usually a migraine involves some sort of what we call prodrome, which means that the person will have other symptoms. Usually they'll feel nauseous, maybe dizzy. Very often they'll have an aura, a sensation that something's going to happen, and that's, precedes the migraine. Migraines have a tendency to be a little bit more vascular in nature. In other words, the blood vessels that go to our brain or in our brain contract and relax abnormally, which causes blood to rush in and out, giving us that pounding type headache.
Well, by definition, a migraine headache has to do with some vascular something, whether it's an inflammatory reaction or flow of blood through the vessel itself. My guest in studio, Dr. Harlan Browning, your host this Wednesday evening at the Roselle Center for Healing. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Also live, we are in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. My guest in studio, Dr. Harlan Browning, will be your host this Wednesday evening, the 13th of the month at 7:30 p.m. He's going to be talking about headaches and migraines. If you'd like to attend that presentation, all you need to do is call 703-698-7117. That's 703-698-7117, and ask my staff to register you for that evening. Our in-house continuing education programs are a gift to you, to our community. There is absolutely no charge. Our dedication is to educate you as much as possible so you can take control of your health and of your life yourself. And as an ongoing effort, we do these on varied topics. This Wednesday evening is going to be on headaches and migraines. Join us. If you're suffering from headaches, find a way to get rid of them, get you off the medication that could be knocking you down, that can cause you other problems. All you got to do is call 703-698-7117. Tell my staff that you'd like to attend Dr. Browning's presentation on headaches and migraines. You know, we're talking about headaches and migraines, Dr. Browning, but there's another topic that I want to talk about because we're running close to time frames for people to take advantage. Ageless Health 2012 is an event that we all do, and it's our keynote. And it's October the 20th this year at the Marriott Fairview Park in Falls Church, Virginia. And the topic is how to live well and prosper in a stressful world. And we've done this, I think we're on our 13th year, 14th year. I keep forgetting to count, but that's what it is. And the topics are going to be fantastic. The things that they're going to learn, the information that they're going to go away with, all the data. It's a very, very inexpensive day. $99 is all that it costs you, and that includes a catered organic lunch. And we start early. We're going to have a demonstration on exercise, and then the Chinese Martial Arts Institute is going to be there, and they're going to show you Tai Chi Guan, and we're going to talk about things as far as how to distinguish between health and wellness, what it really means, the emotional side of healing. A good friend of ours, as a matter of fact, is going to be part of that. Dr. Evan Mladenoff from Kansas City.
Yeah, that's always a fun day. And you know what? I come out of there and I learn a lot of stuff. There's always some information that you pick up, and along the way you have some laughs too.
It is. It's a power-packed day. It's an emotional day. We're going to talk about how to eat well on the run, common origins of diabetes and heart disease and arthritis, what you can really do about them, the applications, body injury, when you take a blow, a trauma, when you just get a little bit of a bump, does it have an impact, what happens, what you need to look for, some of these things that show up and you don't know why they show up. This is a day to fix that. And by the way, you have until the 15th of this month, which is this week, the 15th. If you'd like to attend, you can save 15%. You need to call our office at 703-698-7117, 703-698-7117. You can do two things. You can attend Dr. Browning's presentation on Wednesday night, and you can register for this class and save yourself 15%. All registrants, all of you that show up, are going to be entered in a drawing for a special gift worth $1,000. This is something that you can't afford to miss.
Can I register for that?
You will be there.
Okay.
Yes. For you, your price of admission is going to be make sure that you do a stellar presentation like you always do.
Yes, I do.
Let's go to the phones. Doug, how can we help you? Doug? Hello, Doug? Doug?
Guess we lost.
Doug's there, but he's not picking up. So we'll give Doug an opportunity again. Let's talk a little bit about distinguishing the difference on headaches. We've begun to touch on the subject a little bit. What is a cluster headache? People talk about, well, I've been diagnosed as a cluster headache, particularly guys. And it seems to be much, much more evidence. What does that mean?
Cluster headaches are probably one of the most devastating pain-wise out of all the headaches, but they're really not that common. Characteristically, we see it. It's more in men. Probably has something to do with hormones. Usually it's unilateral on one side of the head or the face, and it just feels like somebody just hits you with a baseball bat. This is the one where the person really thinks they're in big trouble. It's a
headache also that people they go to a doctor, and it comes and goes. It can happen 4, 5, 6 times during the day. And then it clears up for an hour, and then it hits again. It clears up for an hour, and it comes again. It's usually people, in my experience, that are under a tremendous amount of stress, love to internalize stuff, set their teeth, and they have neck and shoulder tension on an ongoing basis.
Yeah, the muscle tension aspect, I personally feel feeds into almost all types of headaches, certainly migraines, and so you've got to look closely at a person's posture, the way they sit, their ergonomics, all those things, because they slowly could be contributing to other issues when they don't even think it.
Well, there's no reason to suffer from any type of headache, as you and I know. The source is the answer, and you need to find that what that's all about. This Wednesday evening, the 13th, give our office a call, 703-698-7117. Tell my staff that you'd like to attend Dr. Browning's presentation on headaches. We're back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. Perhaps you've had a problem. Well, we're going to fix it for you today. My guest today, Dr. Harlan Browning, who will be your presenter this Wednesday evening, the 13th. And he's going to be talking about headaches and migraines. More importantly, how you can get rid of them after having suffered all these years. Remember, there's only three things that cause anything. There's either injury to the body, there's chemistry, all those things you've been putting in your face that shouldn't be there, or the last is a stress pattern. And usually it's a combination of all three. Well, he's going to go through that and show you how to get rid of these things and what you can do once and for all to get your life back and to stabilize things so you can actually have a life, if you will, pardon the expression. Call 703-698-7117. That's 703-698-7117. Doug, let's try it again. Are you there, sir?
Hello?
Hi, Doug.
Hi.
Good. I'm sorry we didn't hook up the last time, but how can I help you, sir?
Hi. I've been diagnosed with restless leg syndrome. It's been in my family. My mom's got it, my brother, but I seem to have the worst case of it. Had all the blood work done over the last couple of years, no deficiencies. Eventually went to 2 milligrams of Requip. That's what I'm doing now. From like 6 in the evening till bedtime, I kind of spread it out, and it's working relatively okay. But what would be your approach to looking at that, given what I've told you?
Hey, Doug, this is Dr. Brown. A couple quick questions. Do you get the restless legs just at nighttime, or is it also during the day?
I used to not get it too much in the day, but now that I'm taking the medicines, I think I'm getting it in the day now. Like I was in a class the other day where I'm sitting in class, most of the day, and by the afternoon I was, my legs were dancing. So generally I was getting at night, and it was keeping me up. Therefore I went to the medicines. But I am noticing it a little bit in the day now. Is
there any other symptoms that you've been experiencing, any numbness or tingling in the feet or anything else that's been going on at the same time?
No, nothing else.
And how old are you?
I'm 60.
Okay. The things that I classically look at coming out of the gate, and let me ask you a few questions. You said you had blood work done. Did they check your serum ferritin? That's the amount of iron that's in your tissues?
Yes.
Okay, and that was normal?
That was good.
And they checked your B12 and your folic acid level?
Yeah, the doctor not only gave me Requip, but I was taking a little bit of B12.
Okay. You started taking that before the Requip or after?
At the same time.
Okay. And then also, one thing you have to remember about the blood work, the body's main responsibility is to keep the blood fairly constant. So we often can have deficiencies and it not show up on blood work. Mm-hmm. One of the things that I also look closely at is magnesium, calcium, potassium balance, and very often the amount of iodine in your body, because iodine has a lot to do with calcium stabilization. So those are some things that I would look at. Certainly acupuncture works extremely well for restless legs. Mm-hmm. And Dr. Tom, I'm sure you see this just as much as I do. So there's we got to look at the big picture.
It's a very common presentation, Doug, and it's one actually that is very, very easily treatable, providing that you can answer the questions. I mean, we can answer the questions that Dr. Browning just gave you. One of the things that you want to be careful of with the medication that you're taking is dizziness, nausea, and excessive tiredness. And if any of those things are showing up, you really need to have a neurological examination, as well as the drug that you're taking has a few side effects, and in most situations they're minor, but they can be very significant with buildup over a period of time. But the underlying why you're having the problem to begin with has to be distinguished, and generally when it's a familial type of thing like that, there's patterns that occur of digestive function. Sometimes it's just that we live the same lifestyle, so it becomes familial and not genetic. That's the differentiating piece, where we live and so forth. But it's something that we treat on a regular basis, and we can help you out.
And on your topic today, if you were looking at somebody or wanted to be checked for TMJ, what type of doctor would you go to that would best be able to handle that and get a good diagnosis?
The best doctor to really understand the vertical dimension of the TMJ is somebody who does neuromuscular dentistry. And they are the guys that are really there's very few of them that get it. You know, when you go to the dentist, for example, and he has you laying flat on your back after he's done a procedure, and he takes that little carbon paper and he has you go tap, 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 and he goes drill, 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 and kind of, grinds off some of the surface of the tooth. So your tooth, and he says, how do you feel now? And you say, oh, that feels pretty good. The problem is most of the guys cut them short. And so now your teeth start drifting and your vertical dimensions off. We have a couple people that we work with, and I'll be more than happy to make that referral to you. Just get a hold of us at rosellecare.com. That's ROSELLECARE.com. And send me a note, and I will send you the referral.
Thank you so much.
Doug, you're welcome.
Have a great day.
We're here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We're talking about headaches, and Dr. Browning is your host today, and as will be your presenter this Wednesday evening, the 13th, as he talks about migraines, headaches, cluster headaches, hormonal headaches, things that you've been bugged for a long period of time. They're very understandable, providing that you ask the right questions. If you don't ask the right questions, you don't get rid of the problem. So this is an opportunity to get rid of the problem once and for all and, make it go away. Let's talk a little bit let's go back to migraines, Dr. Browning. We said, they're a vascular problem. And in a vascularity situation, when a patient gets that migraine over the one side of the head or face, and sometimes they have the prodromal, the twinkly stars, or the aura that they get, and sometimes they feel nauseous, sometimes they end up throwing up. All those are typically migraine-associated types of symptom presentations. Let's go back to we can have a migraine that's actually attributable to nerve or compression in the neck that is restricting the blood flow to the brain, and the patient typically gets the migraine when they relax, not when they're in the hard drive fight flight situation.
Right.
How does that distinguish between other types?
Well, I think if you look at the nervous system like a bucket, an empty bucket, and let's say this bucket can hold 5 gallons, as we put stimulation into the body, and that could be something that's good like the gravity around us, or it could be something bad like we get in a motor vehicle accident, we start adding water to the bucket. So a person that has migraines is like a bucket that's almost completely full. So little bits of stimulation, let's say food triggers or allergies or high amounts of stress, cause this bucket to overflow, and that's when the person will get the headache. So in neurology, we say that their central integrative state, the resting tone of the nervous system, is so close to threshold that any little stimulation puts them over the edge. So migraine people are very unique in that they often have lots of triggers. Unfortunately, those triggers are usually things that are pretty common, things we eat, things that we run into in the day.
The migraine pattern itself is significant in diagnosing if you stop and ask the question. The problem is that most people don't ask the question, but we can have a migraine that is vascular. We can have, and it's strictly because of what we talked about is the restriction of blood flow. But we can have a vascular headache, which is a migraine, which is hormonal.
Certainly. And
that is often an inflammatory pathway problem or an effect on the artery.
Yeah, so when I go over my 9 causes of headaches, one of them is definitely we'll look at hormones and what we call endocrine disruptors. That means substances, toxic substances that we get from the environment, estrogens that are in the water supply that shouldn't be there, and things that mimic our hormones. What they basically do is they get into our body and they attach to those receptor sites or those lock and key mechanism, and they trigger events to happen. The problem is they prematurely trigger things and they mimic what should be taking place naturally. So it can be very devastating. And there's a lot of folks that are drinking out of plastics, and there's a lot of folks that are drinking tap water that's just not pure.
No, and that's the problem with most of our foods, and we see more and more people have problems with, as you say, receptor site incompatibility or lock and key problems, and we talk about it when it comes to inflammatory pathway problems with diabetes and heart disease and so forth, and thyroid problems and testosterone levels and so forth. Most of those things are a result of what we're talking about with headaches. Some people end up with a headache.
Yes, and unfortunately, women, have a tendency to have more migraines, and it probably has to do with the balance of good estrogens versus bad estrogens.
But also, in my guess and what I see in experience with patients, it also has to do with the abnormal ratio, if you will, between estrogen and progesterone.
Sure.
They don't balance out the way they're supposed to.
Most women are estrogen dominant, and it's kind of interesting to see that most medications to help control hormones are estrogen based, so it doesn't really kind of make sense when you look at the physiology. Unfortunately, that's what we see being utilized for all types of problems, so it just, again, pushes the system too hard.
But the effect of that, when they give that type of medication, is that when you put too much estrogen in the system and you're not balancing out with enough progesterone in a natural state, you end up with a greater predisposition to all types of soft tissue cancers.
Certainly. And the interesting thing is that carries over to men, too, because men produce levels of estrogen and progesterone, too. So as their estrogen levels go up, and the neat thing, I shouldn't say neat, but the interesting thing that we see now is we now know that fat cells produce estrogen. So as men put on weight, their estrogen levels go up also. So the same effect happens in guys. We just don't think about it that way.
And it's that fat around the belly that's the one that's
centralized
the most dangerous.
Obesity.
And, I tell guys who come in, I said, listen, you got a problem here. Just understand something. Women are ending up with more and more breast cancer today, in my opinion, because of all the environmental estrogens. But your prostate, as well as the same tissue genetically as breast tissue. And subsequently, we're seeing more and more men with all types of different types of prostate cancer.
Yeah, and you're certainly seeing get it earlier and earlier in life. So there's something going on there.
How many people would you guess? I mean, we know that migraines, there's some estimates that say up to 10% of the population suffer from some type of migraine headache. And then headaches throughout, we're talking about 75% of the population of people at one point or another are going to have a headache. This is not okay, and people think that taking medication is take this for your daily headache or your normal headache. There is no such thing as a normal headache. How can you get people to realize that they, it's in their control, it's within their hands to change this thing, and more effectively, it doesn't mean that a headache is a drug deficiency? Well,
simply, I think for those folks that are listening today that have migraines and they're on medication, I want you to look closely at the medication that you're taking, and I bet you it's either one of two things. They put you on a beta blocker, which is actually designed for blood pressure, or they put you on an anti-seizure medication that's designed for seizures. So off-label use of medications, albeit that they curb the symptom, are not designed specifically to be utilized in those situations. So even though you're feeling better, I would question the fact that you're taking something that's for a problem that's completely different than what you're experiencing.
The whole idea is really to find out the underlying why. I don't think in all the years I've been in practice I've ever seen a headache or any problem that comes about that didn't have a cause. What I try to tell patients is your headache, your problem, whatever it is, whatever the diagnosis is, did not just choose you that day. That there is a why is that. There is a timeline, if you will, that certain things took place. It can go back to birth and the process of the body's adapting, and suddenly it gets to the place it can adapt. How many patients do you see over a period of years that headaches and that upper head pressure behind their head and so forth is a result of a birth trauma or a bad birth process?
It's not that uncommon, and certainly if we want to extend that a little bit to injuries a child might have in the first 2 years, then it becomes pretty common. Unfortunately, when we're 2 years old, we don't have a recollection of this, so we have to often ask the person to ask their parents if they're still alive. Was there an issue, was there an injury, or things like that, and very often the process was put in place, many years ago.
My son is now 36 years old, and going back to the time when he was born in Michael Reese Hospital in Chicago. And Sue was in labor with him for 44 hours. It was a very traumatic situation, just as far as time and not knowing what was going on and so forth. And at that point, this Iranian doctor, and thank God he was who he was, the protocol was, at that point, they were either going to do cesarean section or they were going to do forceps because he was crowning, but he wouldn't come through. She just didn't have the muscle contraction to push him out. And they were going to use forceps to pull this kid out. And I looked at these flapjack tongs that they were going to pull this kid out with, knowing full well what happens. And I told them, I said, you're not going to use those things on him. And so how they ended up delivering her was pushing him out from one. He got a resident, one resident pushed on the belly. He manually dilated, and my son was born that way. But so many children that we see over a period of years are born with the intervention of forceps. And what I'm trying to express is that process all by itself can distort the head and neck to a place where over time, when the body can no longer adapt, the child has a problem. We're coming up to a break, and we're going to recap some of this, but this Wednesday evening, Dr. Harlan Browning is going to be your host, your presenter at the Roselle Center for Healing. He's going to be talking about headaches, Wednesday the 13th at 7:30 p.m. Give our office a call, 703-698-7117. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio at WMAL, 888-630-WMAL. That's how you find us every Sunday at 12 noon, bringing you the most up-to-date information we can on alternative therapies. Want to remind you, Ageless Health 2012, how to live well and prosper in a stressful world. It's going to be a slam dunk. If you really want to take control of your life, this is your opportunity. We're going to talk about all kinds of things that are going to be important to your survival and your healing and your wellness. And I would encourage you, please be with us if you're really serious about doing anything for yourself. Fairview Park Marriott Hotel, Saturday, October the 20th. And this is the last week you'll have the opportunity to save 15% on an already very inexpensive day. It's only $99, and we provide lunch, an organic lunch, and it starts in the morning and it goes to the end of the day, and trust me, you're getting a bargain. Give our office a call at 703-698-7117, and those of you who attended in the past, get an even deeper discount because it's our gift to you, because we want you back. We want you to continue to learn, because every year the subject and the topics are different. Same enthusiasm, same level. And don't forget, Dr. Evan Mladenoff, who was the doc for the Kansas City Chiefs for over 12 years, will be our guest presenter. Be there with us. Dr. Browning, coming up Wednesday the 13th, this coming Wednesday evening, you're going to present headaches and migraines. Tell us why.
Well, this is actually the first time I've ever done this presentation, which is kind of surprising since I have like a neuro background. But we're going to go through my 9 causes of headaches. The neat thing about the 9 causes is they're actually the 9 causes of most problems. So this lecture, albeit it's about headaches, could really be about any health problems. We're going to look at different ways to diagnose, different lab tests that we can utilize, different types of imaging that we can use. And then we're going to look at a lot of conservative options on fixing the problem, getting people off of seizure medications, blood pressure medications, and all the other nonsense that you see folks take on a daily basis just because they were told to do it.
It's amazing to me that people will go to their physician, and just because he says, well, let's try this, let's see what happens, without even knowing the cause, the underlying why is that. I know that you're going to get in depth into that, and you're going to start picking this thing apart. And the beauty of it is that it can be fixed. It certainly can be fixed.
For the most part, with any patient in my office, and I'm sure it's the same with you, I always tell them that 85% of the healing process takes place when you walk out the door and what you do with yourself. We just facilitate it.
This Wednesday evening, Dr. Harlan Browning is your host. Call our office, 703-698-7117, 703-698-7117, and we'll be here next Sunday at 12 noon, bringing you some more information. See you then. Bye. Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live, Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com. Suffering from chronic health problems? Tired of taking dangerous drugs? This is Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me on Saturday, October 20th for my Ageless Health Seminar, How to Live Well and Prosper in a Stressful World. And I'll show you how to increase the quality of your health and length of your life. Saturday, October the 20th at the Fairview Park Marriott Hotel, Falls Church, Virginia. Seating is going fast. Don't be left out. Register today at rosellecare.com or by calling 703-698-7117. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.